Hello, ladies and gentlemen. Thank you for being here and listen our presentation. I'm Jessie, and this is Louis. This is Aaron, and this is Daniel. It's our pleasure to give this presentation. Today, our presentation is going to talk about what can other countries can learn from Taiwan's experiences in quality health and medical care. Let me show the outlines to you. First, I will introduce Taiwan's national health insurance. Second, we will show the advantages by comparing other countries. Then, we will talk about how Taiwan faced coronavirus. Finally, we will explain what other countries can learn from Taiwan. Taiwan's national health insurance started in 1995. It is mandatory for the citizens in Taiwan to join national health insurance. The coverage rate is 99%. According to U.S. National Library of Medicine, Taiwan's system allows for greater patient choice, and the national health insurance has a very high satisfaction rate among Taiwanese people. The national health insurance covers almost all the services that can be provided by a health system, from dental care to childbirth, from Western medicine to traditional Chinese medicine, and from preventive services to elderly home care. In satisfaction rate, Taiwan ranked first among 93 countries around the world. According to the Healthcare Index, it showed that Taiwan has the best health insurance system in the world, and Taiwan is the model that other countries can learn from.
After having a concept of Taiwan's national health insurance, let me show you what's the difference between Taiwan and America. The first difference is health insurance systems. In America, they have what's called multi-payer system. Under a multi-payer system, there are lots of different insurance providers. Also, the hospitals in America are all privatized. Their hospital can decide their medical expense by themselves, and that is the reason why the medical expense are getting higher and higher. How about in Taiwan? Our system is single-payer system. The medical expense are all controlled by our government, so the medical expense is affordable to patients. The second difference is medical premium. Due to multi-payer system, America's medical premium do not cover every medical care service, such as vision and dental. So that means you need to pay the medical premium for every medical care service. On the other hand, Taiwan's medical premium has covered every medical service. The third difference is convenience. Why do people take a long time to see a doctor in America? Because they need to make an appointment in advance at least 2 weeks ahead. In Taiwan, however, we have plenty of hospitals, and they are located near community, so we can easily to see a doctor.
I am going to introduce how Taiwan faced the coronavirus. Coronavirus was carried almost all around the world. It spread fast and dangerously. While our prevention can succeed, our success has 4 major reasons. First, preparedness. Remember the SARS' serious effects to Taiwan, so we keep attention to epidemic at any time. Second, fast reaction. Our government set up the Central Epidemic Command Center on mid-January. After Taiwan received the news of coronavirus, the center was quickly put in action on January 20th. In just 3 weeks, more than 120 virus prevention actions were put into place. Third, tracing and testing. Taiwan was also quick in screening passengers who arrived at the airport for visa surveillance. and quarantining them for 14 days. Besides, Taiwan widespread testing for those who may have contracted the virus or been in contact with them. Finally, using big database and technology, Taiwan's national health insurance was using big database among other strategies, allowing Taiwan government to issue timely alerts to ensure public safety. Therefore, of all the countries affected by coronavirus, Taiwan has the lowest incidence rate. The outstanding result shocked all the other countries around the world.
There is no easy answer to the topic. However, based on our presentation, we have come to the conclusion about what other countries can learn from Taiwan. First, take quick and decisive action. Taiwan releases epidemic prevention information with active, timely, and integrated measures. It will have made a crucial step towards good governance. The most effective mitigation measures for epidemic prevention. Second, generosity. Taiwan uses our resources to help other countries, such as masks. Taiwan donated 10 million masks to many countries, such as America, Singapore, European countries, and so on. Third, teamwork. According to the China Post, Taiwan has effective captain and a good crew, such as government workers, doctors, nurses, police, and citizens, have all stepped up and played a role in our ongoing battle against the virus. Last but not least, sound national health insurance system. Taiwan's health insurance lets everyone not be afraid to go to the hospital. If you suspect you have coronavirus, you won't have worried that you can't afford the hospital visit to get tested. This is our presentation. We hope you enjoyed our presentation and are able to follow our reasoning to this topic. We thank you for your attention, and if there are any questions, please feel free to ask. Thank you.